Now joining us now with more, infectious diseases specialist Dr. Susie Hota and epidemiologist Deonandan. Thank you both for being here tonight. Dr. Hota, I'm going to start with you. What should people take away from the science advisory table's information today? I mean, it is anticipated that numbers will go up when mandates are eliminated. And is this just not really anticipated as we move forward with life? What should people glean from this?
Well, like you said, I think we expect that numbers will go up, but really what we need to try to do is make sure that we curb hospitalization. So let's watch those numbers carefully and adjust our behaviors as needed. We don't want to have to do anything strict. So, small differences and decisions that we can make about our social contacts, about wearing masks, and about continuing to make headway with third dose vaccination, improving ventilation in indoor settings. All of these will help us to get through these waves that we may anticipate will occur because, people are interacting more as we move forward. We're removing some of these public health restrictions as, we had hoped to be able to do at this point. And also variants will continue to arise. And we know that the BA2 variant is increasing in our communities in Ontario. And so, we just need to be prepared to deal with all these things and get through it as smoothly as possible.
Mm-hmm. And the science table's information is that, again, the information they're providing is quite clear and consistent with what would be a moderate change in the behavior of the people of this province. Ray Watt, when we take a look at a behavior change on Monday, in Ontario schools, right across the province, there will be the lifting of the mask mandates. Now, we just learned tonight the TDSB's request to have a bit of a buffer period was denied. So students at TDSB schools will not be required to wear masks on Monday when, of course, students will be returning from March break. Something I want to clarify. So the TDSB says schools and childcare centers in which children return from travel, they have to wear masks for the first 14 days following travel outside of Canada. I believe I said earlier, it's if you're unvaccinated, it appears that it doesn't matter your vaccination status. The chair of the board says he doesn't have information on how they would enforce this. How concerned are you about that? Someone returns from travel, a child doesn't wear a mask, let's say, and the TDSB has no enforcement plan.
That's not good. It really is mystifying to me why we're lifting the mask mandates so early, frankly, given that we're projecting an increase in hospitalization usage, an increase in cases, when mask usage is a low-cost, high-impact endeavor that can quite effectively quell a big part of that potential lifting. And the science table is right in that it all depends on the extent to which public behavior changes. And if we're signaling that it's okay to stop wearing masks, we've got to be careful how we signal that. We may be telling people the pandemic's over. It's not over. In fact, everyone should try to wear masks as much as they can. The more people that wear them, the more the impact on community transmission will be evident.
Ray, what do you think we will see on Monday? And Dr. Hota, this question for you next as well. But do you think we will see about half of people walking around, workplaces, schools, whatever the case may be, wearing masks, another half not? Or do you anticipate some, the mass ditching of masks if you're not required to wear them?
It's funny. My spouse, who's an MD, and I have a bet over this. I think the majority of people will actually do away with the mask, and she thinks they won't. And I think the truth will be somewhere in between. Mm-hmm. So I have no idea. This pandemic has surprised me every step of the way. People's behaviors have not been lockstep with my expectations. I think for the most part, though, I'm an optimist, and I think people will tend to do the responsible thing. But the distribution of that responsible action will be heterogeneous across the population. I think in urban centers, masking will be more common. In less urban centers, it'll be less common. And it will depend upon, the ideological bent of the population.
Mm-hmm. That's a good assessment. And Dr. Hota, what would you say? I mean, when we take a look at messaging, you have to wear your mask on public transit until April the 27th. And throughout the whole pandemic, you had to wear masks on, the TTC, and sometimes some people wouldn't. But overall, most people would from a compliance perspective. So what do you anticipate?
I also tend to be optimistic. I think we're going to see, at least in the early week or two after the mandates are lifted, that people are going to continue to wear masks in indoor spaces, particularly in these higher risk areas like, public transit. I know that's going to be required for some time, but, I think that people may choose to continue that for longer. And I certainly hope that that's what happens, especially with all the uncertainties of the upcoming months and, with the projections being what they are. As Dr. Deonandan had mentioned, this is a very high yield and low cost intervention. We've got lots of data that masks can actually help prevent transmission. And if it enables you to do more, why not?
Dr. Hota, how confident are you in the signs tables analysis when they say themselves, and I quote, restrictions on the availability of PCR tests and a lack of positive rapid antigen test results have limited efforts to model the spread of infection in Ontario? I mean, do we really have a clear idea of where we are?
I think we can follow trends and have a better idea of what the trend's looking like. But, absolute numbers and the degree of increase that we can expect is really difficult to predict. We've lost a lot of the tools to do that. So I think, again, the messaging becomes really difficult because a lot of what we're saying is we have to watch and wait and see how it transpires and adjust our behaviors accordingly. That's really not satisfying to tell people who have been dealing with this pandemic over the last 2 years and are feeling the frustration, as we've heard from interviews on St. Patrick's Day, of people wanting to get out there. But that's truly what we have to do. We have to watch these trends really carefully and course correct as necessary because those tools just aren't there to give us accurate numbers.
And Dr. Hota, the science table provides that same caveat. So Ray Watt, what do you make of this? They say the province must be prepared to reintroduce mask mandates, vaccine passports, and continue to improve ventilation and air filtration in public spaces here in the province if the spread gets out of control. So that's a bit of a warning.
It is a bit of a warning, and I'm fond of saying that public health is the art of the possible, and the possible is gated by two things: public willingness and political will. And the political will, I think, is absent to reenact restrictions if need be. And the public compliance really is dependent upon the extent to which we are communicating the necessity for these actions early on. And I think the science table is signaling we need to start that communication process now. Get people to understand that if behaviors aren't in line with what we expect, we're going to have to make some hard choices. So I hope our leadership is prepared to make those hard choices, but I have my doubts.
And there are some people that are in a much more challenging position than others in the province. Those who are older, immunocompromised. I mean, they will be walking around this city, perhaps masked, because that is what is recommended for them, but with others who aren't. And the science advisory table says the risk of severe illness is still a great concern for these people. Are we letting the most vulnerable down here? I'll start with you, Susie.
Yeah, I mean, it's really difficult, right? Because we're all going to have to make different decisions based upon our own personal risk and those that we live with and are around, that we interact with on a regular basis. And so there is this new layer of inequity that's being introduced by having, these decisions being made up to, left up to the individual and taking away the mandates. That I find a little bit hard to swallow. I think all we can really do is try to, allow people, give people the information they need to make these informed decisions, and really, really ensure that they understand how important it is to get those third and fourth doses for immune compromised and long-term care residents and elderly, frail people who qualify for them. We just have to do what we can to make these things available and have people recognize how important it is right now to do that.
And Ray Watt, final thoughts based on this latest data from the science advisory table, and then on Monday, the lifting of the mandates. I mean, are we going to have to return to this at some point?
I think we might have to. Now, we're at a watershed moment in our societal evolution here. And what I mean by that is we have to decide what our values are. Are we the kind of society that sacrifices a little bit for the overall common good to protect the immunocompromised? Or are we the kind of society that wants individual rights and freedoms at all costs? And I don't know what the answer to that is, except it's an important decision that we have to make from the leadership on down to the common citizen. It's an important
There's
moment.
so much that's unpredictable. We almost thought we were out of this, and then Omicron hit, so it is really hard for anyone to predict. Dr. Susie Hota and Ray Watt Deonandan, thank you so much for being here tonight.
Thank you.
Thank you.